Good afternoon, everyone. For those I haven't met yet, my name is Christine Anderson. I am the Anti-Trafficking and Runaway and Homeless Youth Programs Coordinator here at OCFS. In that role, I also serve as the Program Manager for the Safe Harbor New York program, and that's what brings me here with you all today. I so appreciate you being here for our second session of Summit. Our first presenter is Aaliyah Howard. She is the Erie County Safe Harbor Coordinator and Human Trafficking Services Program Coordinator for the International Institute of Buffalo. She is the primary contact for Erie County Safe Harbor, like I said, and leads community collaborations focused on identifying needs, gaps in services, and supports for at-risk and trafficked youth. She regularly trains on human trafficking and coordinates service provision for youth survivors of human trafficking in Erie County and across Western New York. Her co-presenter is Sarah Rosenblatt. She is a senior youth case manager for trafficked youth at the International Institute of Buffalo and a part-time MSW student at the University of Buffalo. She's been doing this for just over 2 years and is very passionate about amplifying the voices of youth who have suffered exploitation and systemic oppression. Her day-to-day work includes safety planning, rights education, and advocacy from a harm reduction approach. I've seen this presentation. It's wonderful. You're going to love it. Take it away, guys.
Hi, everyone. Thank you for joining us on this lovely, kind of sunny from where we are in Buffalo, New York afternoon. Give me just one moment to pop up our slides here. And we'll go. So we are so excited to talk to you for the next chunk of your afternoon about harm reduction, about what it is, what it means, how it fits ethical anti-trafficking work. And really, our goal through this conversation is to provide concrete tools and strategies to demystify, make it a little bit less scary when we're talking about doing harm reduction work with youth. So thank you to Christine for that lovely and kind introduction. Sarah and I are coming to you from the International Institute of Buffalo, unsurprisingly in Buffalo, New York. We are a resettlement agency. We provide translation, language access, interpretation. We do a lot of amazing things with global visitors. Really, though, we're coming from the Survivor Support Services program where we have specialized domestic violence services and human trafficking services. So we started doing anti-trafficking work at International Institute in about 2006. So, we had been doing it for a while. We learned some lessons. We've made some mistakes. We found some ways to grow forward. By the time New York State was ready to start implementing safe harbor programs. So we were really excited to be one of those first 5 funded counties doing safe harbor work across the state. And really, human trafficking services for us look like, client-driven, choice-based, harm reductionist services for survivors of human trafficking of all ages, all genders, all races, all countries of origin and citizenship statuses, and all different types of trafficking experience as well. So we are excited to be joining you, but let's see who's in the room.
All right, so we're going to start off with some polls to get a feel for who's here and where everybody is at in terms of knowledge and comfortability with harm reduction work. So if we can have the first poll up, and our options for who is here in the room with us are attorneys, residential staff, anti-trafficking program staff, folks from Department of Social Services, law enforcement, or if you do not fit into these categories, another option, and please let us know where you're coming from.
And feel free to write that in your chat box. And it looks like all 3 polls are up at once. So,
okay. Yeah, so then familiarity with harm reduction, whether you are not at all familiar, a little, or fairly familiar, 1, 2, and 3. And then harm reduction is, so what your thoughts are and where you're at. If it's very scary, maybe interesting. Okay, so we have about 4% here from residential staff. About a quarter of us are anti-trafficking program staff. 28% are from DSS, only 1% from law enforcement, and a couple from other. Oh, about half, more than a couple. Okay, very nice. And half of us are a little comfortable with harm reduction. We have a few not at all, and a few more pretty familiar. And 50% of us say that harm reduction is maybe interesting. So we're happy you're here to tell you more about why that is true.
Well, and 36% of us love it. This is so exciting. Usually when I start a conversation with a large group around harm reduction, people are nervous from the get-go. To see that, 90% of us are even a little bit familiar with harm reduction is really exciting for us. So let's talk through our plans for the next hour and change.
Okay, so our goals will be to introduce harm reduction in an anti-trafficking space, and then more specifically with youth. So we'll start general, get more specific to kind of the tools we use in our day-to-day work, the successes we have found, what works well, the challenges, things that work not so well, and we'll go through a couple case examples of what this really looks like in practice, and then we'll have time for questions at the end.
Absolutely, and Christine and Shannon are both helping us monitor the chat box, so feel free to write questions that we need to address in the Q&A section right in the chat box, and they'll help us keep track of everything so we don't lose content or don't lose your questions. So for folks that are newer to talking about harm reduction, or maybe folks that just need a refresher because it's Monday morning, harm reduction in terms of the research and the way that it's been applied in the field has really centered in or been grounded in substance use work across the US and across the world. It's been grounded in HIV work. They're starting to get a little bit of a better research base in the field or in folks that are doing survivor-led, participant-led work and research around consensual adult sex work in the US. So there's certainly a kind of a draw to find a research base when we're talking about harm reduction. And, there's a lot of work to do when we're talking about, evidence-based kind of implementations or kind of approaches and things like that. But really, when we're talking about harm reduction, we're talking about a framework, we're talking about an approach that is grounded in justice, it's grounded in human rights, and really meaningfully meets clients, meets survivors where they are, right? This is absolutely a judgment-free zone. This is, no preconceived kind of notions about who can receive services. This is really, again, trying to make as low barrier approach and options as possible. And so for those of us that are really centering our day's work in an anti-trafficking space, whether that be a safe harbor program, whether that be, DSS liaisons for safe harbor or anti-trafficking work, these kind of bullet points really could be a description of what an ethical anti-trafficking approach could look like, right? There's a lot of research coming out around, how do we do better sobriety support research? How do we do better work from this framework? OCFS has started talking more and more about it, which I really appreciate it, and using some of that lens about risk reduction, risk tolerance. So you might have had some more exposure to this kind of framework of supporting safety and harm reduction through maybe a different lens, but certainly something that we want to be able to bring to and introduce into this space. So other perhaps familiar interpretations of harm reduction really look like some of the Know Your Rights trainings that many of us are engaging in, especially those OVS providers. For those of us who are on the morning session, right, crime victims' rights from the Office of Victim Services, that Know Your Rights kind of approach. Many of us on this call are trained and certified in using Narcan to prevent opioid overdoses, right? There's lots of examples of what harm reduction in action looks like. Again, some of them are specifically around medication-assisted treatment for those that are struggling or kind of dealing with substance use or misuse, but we're also looking at trauma-informed care being harm reduction in action, right? And many of our programs are deeply committed to engaging in trauma-informed care in practice, not just in a grant application, but actually living this work and working this work day to day. Harm reduction, it's a dynamic process, just as safety planning is, right? Harm reduction on, June 1st isn't going to look like harm reduction on September 15th with the same people, right? So again, this is a dynamic process, and it's a framework that, strives to support safer decisions towards whatever client's goals are, right? So again, a multitude of strategies. It's not a prescription, it's more of a framework in how we're able to move forward together.
Okay, so harm reduction specifically in anti-trafficking. So from a lot of what Amelia just said, I'm sure some people are realizing that we are actually already doing a lot of these things in our day-to-day work. And the biggest way that harm reduction helps in anti-trafficking is that framework. So what we are looking at is more of how we're doing the processes and the methods of our work over the outcome of what we're working towards, which is how we are able to make this a truly client-led approach. So we are always respecting people's autonomy to make their own choices, letting them make their choices, and focusing on how to reduce harm. So really meeting people where they are. So things that have worked are making sure that we are aware of our own attitudes when we're working with our clients in these spaces, coming from a yes framework, and seeing how we can get working backwards from yes. So what can we do to get the closest to the client's ideal situation? And also making sure we're always sharing information to fuel that sense of control and give them the tools to feel comfortable making these decisions. As we all know, that's usually a new thing for our clients, making decisions and having that choice and autonomy. So anything we can do to make that feel safer and get them more accustomed to doing that and taking that kind of control is what we're going to aim for. And also remembering that clients have kept themselves alive and well, maybe to their own definition of well, long before we've been here. So we also want to make sure we're not doing anything to incur any harm that they might be anticipating based on where they're coming from and where we're meeting them. So again, really honing in on that autonomous self-empowerment client choice model. And remembering that that's going to take a while, change is slow. These are new spaces, new ideas, new opportunities that clients are being given from us when we do take on a true harm reduction framework. So being aware of our own attitudes, our own biases, and making sure that that doesn't come through towards the clients that we're working with.
All right, so when we talk about harm reduction with youth specifically, there are lots of ways in which we could call it an emerging best practice, right? It makes sense. Harm reduction fits all of those core values of trauma-informed care and implementing trauma-informed care, right? So again, not, the textbook or grant application version, but the real life, right? How are we bringing meaningful, in practice, trauma-informed care that matches harm reduction, right? We know anecdotally from folks that are doing, that human rights-based approach to anti-trafficking work across the country, we know that it fits. We know that when we do client evaluations and program evaluations, we know from those kind of those tools that it meets clients' needs in ways that an abstinence-only program wouldn't, right? So we're hearing this feedback. We're talking to colleagues in runaway homeless youth kind of spaces who are saying, like, of course we're talking about harm reduction. We're not going to say, well, you ran away once, you're never welcome back to the RHY provider again, right? So there are folks that are already doing the work, but we don't have a ton of research to back it up, right? And so sometimes when we're having these conversations with partners that are maybe more hesitant or more nervous about these approaches, they really want to see the research. We're working on it, I guess, is where we want it to be. We don't have it yet. Doesn't mean that it's not coming, right? I know there's a couple of projects that we've been connected to that are really starting to kind of track to kind of break into that space. So hopefully in the next 5 years or so, we will have more of that information. to be able to have that again in that kind of evidence-based place. We do have research that backs the finding or the assumption or understanding that abstinence only or a zero tolerance policy with youth doesn't work. It doesn't work in our day-to-day, and it doesn't work on paper in peer-reviewed journals. So I think that that's kind of a positive approach in terms of what we can see from that kind of research-based perspective. So we can get to the point where we understand that this makes sense. Great. And it's complicated, right? There are a lot of feelings involved. There's a lot of nervousness. There's a lot of ways that, harm reduction with youth can feel really uncomfortable, right? We recognize that, there's lots of ways that you don't have to like a young person's behavior. You don't want to have to support the behavior, the choices that they're making in order for you to want them to be safer in the choices that they're making, right? We don't have to like what is happening, but we do want to be able to support them, right? So kind of owning the us piece of it and the, what's actually going to be more supportive and more successful in what we're doing and in terms of the ways that we're supporting youth moving forward. So we're going to talk through, again, some really specific examples. We're going to go into the weeds on strategies that have been really helpful in meeting youth from that harm reductive perspective. And then we're going to talk about success strategies. We're also going to do a bunch of kind of case examples to invite feedback in the chat box, and then some ways to kind of strategize around how to kind of build these collaboratives, how to kind of shift that needle towards a more harm reductive perspective moving forward, right? Because again, there are lots of reasons that this makes sense with the youth that we are working so hard to support.
Okay. So I will talk through each of these in a little more detail and then go through those deep dive examples. So one of the biggest things that we see in our work is continuing to work with youth during runaway periods. And those have even been things that we have safety planned for with youth. So, if you've worked with a teenager, you have probably concluded that they're going to do what they would like to do, regardless of our well-intentioned suggestions and all of the things that go into that. So when we're working with youth who are either running away from where they are or they're AWOL from placement, we are always going through and talking about their rights around confidentiality and letting them make the choices of what they want to disclose and letting them know what comes with that. We are making sure that their basic needs are met, even if they're not where they should be, especially if that's because they don't feel safe returning there. And that also plays into making sure their phones are on. So if they don't have a way to get in touch with us, we can't really do much to help them. And instead of waiting and hoping that they will return or show up where we hope they will, we are going to take the extra step to reduce harm while they're away and give them the tools to communicate with us to get their basic needs met and with any other service provider that they're choosing to engage with at that time. And when we are giving them a phone or helping them keep their phones on, we are always talking through safety with technology. So how to stay safe, how to stay safer if they're engaging in risky behavior, making sure they're aware of things like VPNs and web addresses and potentials for their information to be tracked, really making sure that they know all the risks of all of the actions they are either engaging in or considering engaging in the future. And increasing safety in relationships, we do a lot of that with modeling our own work and always emphasizing that whatever we are providing them, whether it's a service or a basic need item, that comes with no strings attached so that they don't end up in a weird manipulative binding relationship while they're seeking other ways to get their needs met in unsafe situations. So things of that nature, making sure they know what normal boundaries look like. We're doing our best to do that with safe adults, with family members, with other providers. And a lot of times we are pulling in other providers, whoever the youth is working with, to have those conversations to make sure that that same message is being emphasized and reiterated through and through. And along with other service providers were bridging communication and support with family and other systems. So especially in those scenarios of AWOL or runaway, we are not, we'll suggest, we will emphasize, we will explain all of the pros and the benefits of returning to care while fully acknowledging that that may feel really unsafe and really scary to a youth. So again, driving information, rights education, laying out all the options, if this, then what might happen, and allowing them to make their own choice and what they think is most safe, which again can be wildly uncomfortable when we don't see eye to eye. But the more that we respect that autonomy and emphasize it and encourage it, the more success that we've seen in helping youth to make safer decisions. Engaging in their own safety plans, coming up with their own ideas, starting to recognize the patterns of where risks for harm and manipulation might come up in their day-to-day lives. So I will talk through a few examples where harm reduction has really been our backbone in working with clients. So the first is we had a young person who had disclosed trafficking, was pregnant, believed to be pregnant by the trafficker, and the DA's office was involved. And so we were helping this client work through deciding kind of what they wanted to see out of a case, a criminal case. So working with law enforcement, working with community partners, and a lot of what made this work was, again, talking about crime victims' rights, letting the client know you have the right to have these conversations with these people just to get information to decide next steps, and we will help you do that. So what a lot of that was calling the ADA's office, making appointments, and then rescheduling appointments when, this youth felt that they were too anxious to have this conversation, did not feel like they were in a safe headspace to go into an office with a bunch of, members of law enforcement and kind of get ready to be really vulnerable with what happened and make a true decision based on their own values and their own goals. Another big piece of this was explaining that this could be a route to more medical care. So with that rights piece, what comes with determining next steps, determining paternity, things of that nature. And then also a lot of advocacy, again, with the ADA's office around understanding how the culmination of all this trauma and just basic general teen brain development could, present as coming off as apathetic, as being not invested in this case, as not wanting to make ends meet or budge. And really, this was just this client, going through the motions of, I have to do this really scary thing that I've never done, and I'm terrified, and I'm not ready. And letting them know that that's okay if they're not ready. And it's okay to tell another safe adult if they're not ready, and to ask for help with advocacy and how to go forward. And then our next example was another youth who was referred at the age of 13. There were a lot of community safety concerns. There was grooming, there was drug use. Community safety was the biggest issue, not living in a great neighborhood. There were a lot of challenges also just in this young person's support network. Their guardian did not have the tools or resources to address all of their needs. There was a bunch of other kids and adults in the house, multiple CPS cases, ongoing systems involvement, so a lot going on. And some of the strengths that we really highlighted with this client was that they were brave enough not only to reach out and ask for help, but also to really strategize how to do that. They, like I said, there was a lot of systems involvement. There was a lot of mistrust on all levels, on a generational level from, multiple different providers. So the way that this client was able to still self-advocate and still, reach out and get the tools that they needed was absolutely something that we were going to encourage and emphasize and really give them, keep working on tools to make sure that that was something that they maintained. And they also had a lot of other great providers that were really willing to go above and beyond. There was, very assertive probation officer, a lot of other just supporting members who were not only open to hearing what the client had to say and how they wanted things to go, but also letting us, again, bridge communication and explain why, a client might be coming off as apathetic when really what's happening is their brain is still developing as far as making logic, rational decisions, and it's also compounded by a ton of trauma. So a lot of what we did was rights education, especially post-disclosures. We provided safe transportation to client and mother to get to doctor's appointments, to get to court dates, anything that was going to benefit the wellness of client and family, mainly client, but also family. And again, collaborating with all of the other providers. So we were collaborating with the doctor's office to make sure that that was a safe feeling for the client environment, made sure that they knew their rights, that they had the ability to ask questions and play a role in their own health and safety. And in other times when this client felt that they really could not stay at home, they needed to get out and just remove themselves from the situation, we were giving them the tools that we were able to provide to keep them safe despite all of these community concerns. So making sure that they had a keychain, an alarm on their keychain in case they were out and, felt like they were being approached by a dangerous individual, making sure that they knew they had the right to shelter, to safety, who to ask for those things in those situations when we're not around outside of our 9 to 5 hours, who is still available and who is going to give them the services and the information that they need in a framework that's similar to ours that will still promote and emphasize their own autonomy and decision making. I think that is everything on those.
Sarah, with this case, I think that there was a great example of harm reduction in action when you got a call late one afternoon from a probation officer who really wanted us to help trick the young person into showing up to address a warrant. Would you speak to that a little bit?
Yes, absolutely. Thank you. So yeah, there was a phone call. There was a ask to kind of set up a meeting with this young person in a setting where the probation officer and other team members would be able to then come and, act on this warrant, which, had we gone through with this, would have really caused considerable damage with our relationship with this client and with, any progress that had come from the probation officer and building rapport. So after speaking with the probation officer and telling them, I don't think that that's going to do anything good for staying in communication with this young person who is frequently leaving where they should be, communicating when they're able, which is not always very often. This could be way more harmful. Let's ask this client, do they feel comfortable turning themselves in? Let's explain that this is a missing persons warrant. They just have to show up. They're not going to be sent to placement. They are not going to be retributed in any way other than clearing this warrant, which is what we did. We did the rights education piece, the safety planning piece, and we were able to get to a space where this client did feel comfortable showing up to court to show themselves in or turn themselves in to avoid any other kind of harm or systems involvement.
Awesome. Thank you. No, a couple more examples, just because, again, I think that it helps us and it helps our community partners to have as many real life examples as we can. I think that, Sarah mentioned talking about rights in a couple of different frames, right? Talking about rights when you're a victim of a crime, to be able to access medical care, to be able to kind of navigate that criminal justice system. But we're also talking with youth about their rights when they're getting a job, right? Because we're not just worried about CSEC, we're not just worried about sex trafficking with youth, we're also worried about youth who are being labor trafficked in our communities, right? And so we're talking about rights as someone who has a job, right? What if there's sexual harassment at work? When should you be getting your paycheck? What should be in there? How do you track deductions, right? All of those skills are part of rights education, and they're also part of ways to reduce harm, right? I think that we all know so many young people that are, trying in lots of creative ways to help contribute financially to the home or to the family or kind of to the household where they're staying. But really, we don't necessarily know as young people what a real job looks like, right? We've got lots of kids who have been working under the table or being pressured to work in under the radar or illegal kind of venues. So really talking through what legal work entails, what their rights are, has been really important for us. Also talking about access, the right to be able to access education, whether that's, elementary or high school, whether that's a GED program, but looking at those rights. We've got lots of young folks that have had to move through COVID, or their family staying in shelter, or they're switching placements, talking about rights through, McKinney-Vento Act or other kind of supports. Making sure, again, we're bridging that communication between systems and families and youth who need that information. And I'll just say again, that safety planning with youth, and Christine mentioned this morning as well, it's another dynamic process. Safety planning for me isn't going to be the same thing that safety planning for our 16-year-old client, right? Safety planning for me doesn't look like safety planning for Sarah or for Christine or for others on the call, right? It's got to be really individual. It's got to be something that will work for this young person in this day, right? Because safety today might not be what safety looks like in 3 weeks. Maybe we tried something and so it worked, and so we're ready to try something else, right? We're again shifting that needle towards safer in a situation, right? Kind of turning that spectrum towards more safety options. And I think the last piece that I would talk to in terms of harm reduction in practice with youth is talking about consent and talking about healthy relationships, right? Lots of the youth clients that we work with are learning about, and here's my sarcastic finger quotes, ready? Talking about healthy relationships from peers in school, right? Or like the city bus going home, or, there's lots of ideas around what relationships look like that are not what any of us would want a young person to think about in terms of a healthy relationship. So we're talking about boundaries and healthy relationships. We're talking about consent, right? Because that also means being able to talk about how youth don't want to engage in some type of sexual activity or kind of romantic activity, right? So consent is saying yes to what they want to say yes to, but it's also having the tools to say no to what they don't want to do, right? We work with too many young people who think that dating someone means that they have to do sexual activity or they have to do whatever that person says. And that's not even only in the context of grooming, right? We've got a lot of missing information about what healthy relationships can look like with young people. Anything else we want to jump in on with this one? All right, we'll move it forward. I love the chat box. I love the friendly and familiar places, or familiar faces, familiar names. And so I do want to speak just briefly to this kind of role of mandated reporters and harm reduction, right? Because Sarah and I, all of our staff, all of our team, all of our interns, we are mandated reporters, right? And so when we're talking about mandated reports from that harm reduction perspective, it looks like talking about confidentiality and rights around confidentiality from the very beginning of our work, right? Before we talk about our program and the resources and the things that we do, we're talking about confidentiality. We're talking about mandated reporting. We're talking about duty to warn. And then we're bringing it up almost every meeting, right? If youth is like, I want to talk about this thing that I'm worried about, great. Let's talk about mandated reporting. Let's talk about confidentiality. Let's talk about your rights. Let's figure this out, right? Because we are making calls. We're making CPS calls when youth are staying with an older intimate partner that has become a person legally responsible. We're making CPS calls against familial trafficking, or when families aren't doing what they need to do to support youth. And so what we're doing, because of course we're following our legal requirements, our ethical requirements as social workers, but we're still doing that in a way that is focused on increasing safety of the youth and families that we're working with and reducing potential harms, right? So when it's something that can make sense and when it's something that's safe to do, so we're planning with youth how to safety plan around that call, right? We're going to make a call this day and here's what the normal process looks like, right? After hours we'll call and the worker will come out within this number of hours and you'll have their number and you can ask them questions. We're talking through that process to demystify it and make it a little bit less scary, but we're also safety planning around what's going to happen when the person that we made that call against gets really upset, right? If we're calling against family members, if we're making a report because of mom's abusive behavior or neglectful behavior and mom and dad have custody, maybe that safety plan looks like going to stay at dad's house that night, right? So there's not kind of violence or a really scary reaction from that person, right? Mm-hmm. So again, keeping that clear communication, making sure that when we're making a report, unless it's going to put a young person at more harm than good, we're telling them that we're making that call. There have been countless times when I'm sitting, in an office just like this, and I'm making a call to the SCR with somebody on the phone so they can hear what I'm saying to build that trust. Remember, we're talking about trauma-informed care values as well. They can hear what I'm saying, they hear what the worker's saying. But a lot of it also is explaining that process, right? I mean, how many of us know families in our communities that think CPS's job, their only job is to take kids away, right? And we know that's not how it works. You all know that's not how that works. But again, demystifying, talking through that process is really an important part of how we're navigating what that harm reduction looks like while we're following the requirement, the intent, and the letter of that law. Great question. Thank you so much. So we talked through a case example. So again, right, harm reduction with youth makes sense, right? We're here, we're seeing it in action. Lots of things that Sarah was talking through in terms of being examples of harm reduction in action are probably things that you and your teams are doing on the regular, right? We're hearing that it works from youth and from teens and from adults. And so this is why we're really trying to kind of learn more about harm reduction as we go. And this is a place where we get a lot of pushback from some of our community partners, right? When we talk about letting clients choose their goals, when we're talking about consent, when we're talking about safety, a lot of that pushback looks like liability, right? Or what's going to happen. It's, a lot of that kind of concern for risk. So I invite folks to just take a moment with me and talk through, what's on your list that makes it complicated to talk about harm reduction with young people in your communities. Are there other things that make it complicated to engage in harm reduction with youth that aren't on this list? Okay, so we've got a couple folks responding in the chat box. Trust makes it hard. Actions of their trafficker make it hard. Absolutely. Looking at anonymity. Policies, yes. Who has it on their to-do list every year to review their policies and procedures, to make sure that we're not just doing things the way we've always done them because that's the way we've always done them, but because that's the best way to do it. Absolutely. Another comment, not knowing the right words to say that will keep youth engaged, right? And I will, if you've met me in real life, you know that I will often just say the wrong thing. The wrong words come out of my mouth. I've got this word soup that comes out sometimes. And you know what? I have said the absolute wrong thing to youth too many times. And then found that kind of space to be able to apologize and say, wow, I really biffed that, didn't I? What should I have said? I should have said it this way, right? Kind of owning that to be able to say. And usually that's an opportunity for us to have that stronger relationship and that stronger trust, right? But yeah, that nervousness of not knowing what to do, especially if we're trying a new strategy or a new approach to work. Yes, we've got a real life thinker in this chat box, recognizing, right, that sometimes harm reduction strategies don't align with keeping a youth safe per child welfare protocols, right? Absolutely, right? That tension between, what you need as a CPS worker, what you need as a DSS administrator, what do we need to do? Because we're liable, we're responsible, we want the best for every youth and every family that comes kind of into connection with us. Of course we do. And navigating that, the time that it takes when we're working from a harm reductions perspective, absolutely speaking to that tension. Again, another really honest take that it's time consuming, right? It takes time to build relationships. It takes time to literally and figuratively meet a young person where they are so we can work together from that harm reduction perspective. Absolutely. Yep, we've got guardians who are not for it. Absolutely. We've had a lot of really intense conversations with guardians around why we want to be able to provide that cell phone, right? And how do we get to that cell phone?
Yep. Again, working back from yes. What's it going to take to make everybody feel safe and comfortable with what we're trying to do, if possible?
Yeah. Yep. Lots of stigma, lots of lots of age in the chat box. And then, so looking at addiction. Yeah, absolutely. Intentional addiction by traffickers to make it more easy to control folks, right? Absolutely. Cultural differences, again, lots and lots of ideas, lots and lots of feedback. Thank you all for kind of naming some of these things that make harm reduction with youth more complicated, right? And so here's my Monday afternoon challenge for folks. Or pin it, because we're in a week worth of great content and great conferences, but put this on the to-do list, right? This right here, these things that make it complicated are great topics to bring to supervision, bring to team meetings, bring to our collaborative partners, other aligned partners, right? Because if the piece that's holding us from meaningfully engaging in this trauma-informed, this harm reduction space is concern about cultural difference or concern about how we're supporting people who are actively using drugs, then maybe that's an opportunity to do some more community training, to ask people who have figured it out a little bit more easily than us, right? None of us have to operate in a silo or in a vacuum, right? We're all working together across New York State to learn how to do better anti-trafficking work with youth, right? So pulling in local or state or other kind of national, not even experts, but folks that have been trying longer, because chances are good some of us have tried something and it didn't work. So we had to try something else, or maybe we tried something that did work really well, right? Because there's no sense in sitting with that kind of, excuse me, I hit too many slides. There's no sense in kind of sitting in that stuck when we know that this is the direction that the anti-trafficking field is moving towards, right? And so when we're talking about lessons learned, I am a firm believer that we should make different mistakes every time. There's no sense in sitting here making the same mistake because we tried putting the square peg into the round hole 112 more times, right? We need to be able to learn to be able to move forward. So I will gladly share some of our own mistakes, some of my own mistakes, right? Because we know right out of the gate, these are things that are not going to work if our goal is to support a trafficked or at-risk youth in making safer decisions and connections with whatever their next step or their next goals are, right? Working on our own timeline will never work. Doesn't work. I've walked into countless meetings with a beautiful agenda, a beautiful plan for a meeting, and we're going to accomplish these 12 things, and we're going to call this person, and we're going to prepare for a family meeting, and we're going to do, right? And we walk into that space and it goes sideways because my agenda, it's not my meeting, it's our client's meeting, right? So looking at that idea of we've got to do this thing in this time frame isn't going to work, right? Putting any kind of preconditions for accessing services or accessing treatment, we say low barrier is best practice for a reason, right? There's no reason to add that kind of barrier. I still am hearing from programs saying, well, you've got to be sober this many days before you can go into treatment. Okay, well, if somebody was ready to be sober for that many days, maybe they wouldn't need that level of treatment, right? So again, looking at and bringing these conversations into our communities are really, really going to be important. You know, I think one of the most challenging ones that I still will hear in our kind of local region is that idea of we need to lock them up, meaning kids, trafficked youth, at-risk youth. We need to lock them up for their own good, right? And to me, that speaks to a lot of secondary or vicarious trauma of the provider that's telling that to me. But it also knows it doesn't work, right? You know, locking kids up for their own good. This is my sarcastic finger quotes. It doesn't work because it contributes to additional trauma. It doesn't include ways in many facilities to address the trauma that already happened. We know that youth run away from placements that aren't good fits and work harder to stay underground, work harder to stay away from any kind of supportive or safe interventions. A lot of our placement options are really far away, so they're further away from safe supports that could help them, again, build towards safer. And we know that the skills that youth need to be successful in group homes and placements aren't the same skills that they need to be independent members of community, right? And I worked in some amazing group homes in my career, and I appreciate them, and I've learned so much from them. And you know, looking at ways to again meet youth where they're at, meet them in community is going to be a better outcome for them and for all of us in general, right? You know, I'll speak to some of these lessons that we've learned that aren't necessarily youth specific, but they're staff or program specific, right? You know, I think that we probably could all name a program or few that their staff is just so burned out, or they've got so many of their own symptoms of vicarious or secondary trauma that they're not able to meet youth meaningfully with that kind of trauma-informed support, right? You know, we still have folks that are looking at this kind of abstinence only or shame-based kind of corrective plan, and it doesn't work, right? We don't have enough research to say that harm reduction with youth for anti-trafficking work is specifically research-based yet, but we do know enough to say that abstinence only or shame-based work isn't going to work, right? So like, again, we want to continue to learn to do better as we're figuring this field out as we go, okay? Again, the piece that I also want to highlight, again, this us piece of it, this provider piece, is that we don't get to ask questions because we're curious, right? And I am probably one of the most curious and the most lean toward asking too many questions person that you'll meet all day. You know, but that's a me thing, right? That's an us thing. We can go be curious outside of work. We can be curious in our team meetings, but we don't get to be curious when we're having conversation with youth, right? In that space, we're asking only what we need to know and not all of the whys or all of the background that we wish we did know, because we're not going to know that piece of it. And I think before I hand it to Sarah to talk about strategies for success and what does work, I will just note that, and again, we get so caught up in the work that I think that we don't necessarily think it through, but in an anti-trafficking space, as an anti-trafficking program, as a conference of providers that are interested and care about children and the work that Safe Harbor is doing across the state, you know, we know that traffickers gain and maintain control through a variety of tactics, but a lot of that is that kind of psychological control, it's that manipulation, right? Our work, in order for it to be ethical and successful, needs to be as far from the control tactics a trafficker used as we possibly can. Okay, it makes sense if you think about it, but sometimes we don't have that moment to take a step back, right? You know, recreating traffickers' control tactics isn't going to be how we are safe, welcoming, inviting spaces for youth to engage while we're trying to prevent trafficking in our communities. Okay, but Sarah's got the good piece. Sarah's going to talk about some of these strategies for success.
Yes. All right. So trauma-informed care is something we are all have heard a million and one things about. When you overlap trauma-informed with harm reduction, again, the biggest thing I use every day from this lens's point of view is education, and especially with the individual who mentioned, being afraid to say the wrong thing, and have youth shut down in response to that, or, losing trust, that kind of thing. I think that education is the biggest, most successful way to avoid that every step of the way. I mean, even if, as Leah mentioned, our timelines are not going to be the same as youth timelines, and balancing that with trying to give youth the power and the tools to make their own safety plans and decide their own goals includes making sure that they are set up for success and they understand why their timeline might not be realistic. We're probably the first people sitting down with them and explaining this isn't going to work, not because you're not capable or not because you are uninformed. You just need more background information and more preparation, things like that, breaking it down so that they see how to pivot and how to move forward to have their actions be more aligned with their goals, and safety and health. And staying low barrier. So that includes if they're not ready for our services right now, and I know not everybody might have this capability, they can come back when they are. We would like them to stay in touch with us as much as they can. But if they are getting what they need from other providers and, they have 1,000,001 other things going on and it's not the right time for us, that's okay. And we're going to tell them that that's okay. If they don't want this right now, that's fine. And if they find themselves in another situation months from now where they have fallen into some pattern of manipulation and some risky behavior and they're unsafe, it's okay if they're ready then to call us and say, hey, I remember hearing about your program, knowing that I can come back whenever, what can you do for me now? And independent living skills. So much of our clients' risk for exploitation comes from simply a lack of independent living skills, whether they have not been in spaces where that's been able to be modeled to them, or it's just been, no one has had the trust and faith in them to be able to learn new skills, to take care of themselves independently based on age or what have you. That's when we really need to remember that they have been surviving and keeping themselves alive for much longer than they've known us. So we are staying as supportive services. We're going to support them in recognizing that they have had that ability and that strength to take care of themselves up until now. And it doesn't have to look the same way as it has at this point. So we're not going to shame them. We're not going to question them on why they did something. We're not going to jump right in and explain this is what you should have done, right? We're staying away from shoulds. We are really staying in the lane of support and putting that filter over anything that we are giving them. Advice, rights education, referrals even, making sure that they know this is the experience that some other clients have had with this provider, and this is a different experience that other clients have had. So, keep an open mind, maybe be aware of these certain things that might be challenges for you in this program, but these are also the potential successes and what you can get out of it, So meeting them where they're at, making sure that if we are setting them up with other providers, other supports, for more long-term independent living skills, that they know what they're walking into and what they can still come back to us for. And maintaining that attitude through and through. There are no silly questions that they can ask us, especially with independent living kind of skills, and making sure, again, that our door is always open. If when you do call back, you are no longer eligible for services or you are living across the country, but this was the number that happened to be saved in your phone, that is not a mistake to have called us. We will help you find whoever it is that will help you most at this point where you're at.
I think that I always like to put a plug in, sometimes we're talking with other programs about kind of just general training or professional development strategies, that are going to be helpful. We found, making sure that folks are aware, obviously, implementing trauma-informed care, that kind of deep dive into training and support in that space has been really helpful, but also looking at things like stages of change, right? Our interventions, our approaches to supporting individual youth are going to be really different when they're coming and saying, yes, I know that I'm in this experience, and somebody said it was trafficking, but it's totally not trafficking, and I'm not actually interested in changing any of my behaviors. Those interventions and supports are going to be very, very different than someone who, moved from another county, has already, talked with an advocate about, having a New York State confirmation letter. They've already reported their trafficking to law enforcement. Their space is different now. Their readiness to engage differently. We've got to kind of tailor our work towards meeting youth, both literally and, again, figuratively, again, where they are. And that includes those stages of change, right? And from each of those stages, we're coming with that harm reduction approach and that harm reduction perspective, right? I think the other thing that we've learned in recent years has been really helpful is to make sure that we are providing training and support for staff around motivational interviewing. That's a frame that's been really helpful for us in, again, kind of, pushing that direction towards safer choices, but also kind of encouraging some of that stages of change work as well. So in terms of resources, and again, you'll have Sarah and my contact information at the end of our presentation, but we will note that Freedom Network, it's a national coalition against trafficking from a human rights and harm reductions perspective. Their website is on the slide here that our wonderful partners at WRI will be able to send out later. But if you follow through their menu to the Our Work tab, then Training and Resource Library, there's a standards of care document for the anti-trafficking field, right? So if you're looking for a number of different strategies or perspectives or tools to kind of shift your policies and procedures, that's a great resource for folks that are looking at kind of updating or double checking your standards of care with folks. One of the other things that we found to be most helpful in, again, working from this framework, again, Dr. Alador mentioned at the intros this morning, there are tensions or challenges in working from perspectives that our community partners don't always understand or agree with, right? And so one of the ways that we found to be most helpful in addressing some of these tensions across the community are things like cross trainings, co-locations, right? Having office hours at one of our community partners' locations, right? These are, when we're talking about kind of strengthening partnerships, when we're talking specifically, or when I'm thinking specifically around harm reduction, I'm looking at ways that we can bridge this risk tolerance gap, right? Who are the folks that are already most closely aligned from the frames that we're working in, right? Because we want to know what those opportunities for growth are in our collaborations, as well as in our own programs, as well as a kind of with our own professional selves, right? And the work that we're doing internally, right? And when I have these conversations with others across our community or across the country, we've got some real geniuses in this space as folks are attending. We've got some really good ideas that, when we come together, we get to ask and we get to learn from. There's the most recent conference I was able to attend. Somebody mentioned the idea of echoing at multidisciplinary team meetings, right? We were talking about, well, this discipline is always so negative, Nancy, when we talk about harm reduction, but I know that there are a couple of other allies in the meeting. So talking into and kind of strategizing and uplifting that idea that is going to be more kind of client-centered and kind of harm reduction focused. So we've got more than one person at that table coming from this perspective that we know is going to be more helpful for young people, right? So again, picking each other's brains and finding ways that, as we someday transfer into doing in-person conferences again, right? Or we're in chat rooms at the beginning, finding opportunities to be able to ask for what other people's successes and ideas were can be so incredibly helpful, right? I love our CAC. I love these multidisciplinary teams. And one other one that I recently heard from somebody, we had a couple of trainers into our local CAC, but they talked about that idea of making sure to report back successes, right? And of course we're like, oh shoot, why don't I do that, right? We talk about things that don't go smoothly at case review, a mistake that happened, or somebody, was late to a meeting, or we talk about the stuff that goes poorly at our meetings all the time, but we don't lift up the successes in the same way. Especially if we're saying, that, we approached a conversation or a goal with a young person from a harm reduction perspective and it worked, that's what we need to bring into the space to show that, yes, it can work, because it's going to give us a much more pleasant meeting to attend to if we're talking about successes, but it also is going to be, that opportunity to say that really when we learn these new strategies, when we're implementing them, it can be really helpful. Thank you. Christine popped into the chat box. We had a question about what is a CAC? It's the Child Advocacy Center. Thanks, Christine, for being on top of our chat box. So I will also note that needs assessments are amazing tools, right? We were lucky enough to have the opportunity a couple of years ago to pay an evaluator to do a formal needs assessment for us, looking at, what are the resources, where are the strengths in our community when we're looking at supporting trafficked and at-risk youth, and where are the gaps, right? It was an absolute luxury to have money to be able to fund a professional evaluator to do that. But I will also note that many of us have interns. Many of us have social work interns who are learning about needs assessments every single year, right? And so there are lots of less formal strategies to be able to identify, again, what are the strengths, what are the weaknesses, where are the gaps in your multidisciplinary team to be able to put this together. Love a good need assessment, and I love providing meaningful educational opportunities for the interns that are working with us. So Sarah and I have talked quite a bit about some of these tangible strategies, about some of the ways that, again, harm reduction makes sense. I feel like I keep saying that, so we'll all internalize it and find ways to do it more in our practice. But we really wanted to provide some case examples, right? And so we're too big of a group to do breakout sessions, and we're all in different parts of the state. So let's do it this way. So Sarah's going to read out our kind of case example, and then we'll invite you to put into that chat box, what do we think might be ways, again, or pieces of that framework, strategies in that framework to be able to support this young person from a harm reduction perspective.
Okay, so first example, youth left placement without permission right before their 18th birthday after being removed from family due to neglect. Family did not believe disclosures of abuse and trafficking and supported trafficker. So what are some responses to this situation that are centered on a harm reduction approach?
What might be some ways that we could engage with this young person? Okay. So we've got some ideas rolling in.
Okay, so let the youth know you're glad they came to speak with you. Ask them what their goals, what their needs are. Absolutely, yes. Asking them, giving them back the power. What are your goals at this point? What are your needs? What do you need to feel safe and supported? Absolutely, good answer. When speaking to the youth, believe them if they disclose, 100%. Let them know that you believe them. Yes, always emphasizing and validating affirmations, especially in a situation like this. Trying to make contact and ask if they're safe. This is based on a real example, and that's exactly what we did. That was the main focus, was maintaining communication and being as available to them as possible to support their safety needs. And informing them of options. That too, knowing where youth shelters are if things get tricky after hours and they need somewhere safe to go. Who can they talk to and where can they go to get their needs met? Letting them know the door is always open, believing them, offering to connect them with appropriate resources, and letting them know they are not alone. Yep, again, that's exactly what we did. Ask what they need in terms of shelter. Yep, so conversations around where are you going to feel safe? Where do you actually think you're going to be able to stay? If you are leaving a placement, that is something that is now an option to you. We don't want to put them in a shelter where they're going to feel the pressure to leave again. And also fully acknowledging that that might be the only shelter option available. So this is where that education piece comes in of, I'm going to be really straight up with you. This is your option. You might have been there before. It might not have worked out. I'm telling you this so that you know it's available to you, not because I am ignoring that this did not work out in the past. Yeah, basic needs first. So, yep, when we are maintaining communication, even if that means, 5-minute check-in call once every couple days, what are your basic needs? Do you need help meeting them? What can we do to make sure that that is all taken care of as much as possible? All right. Acknowledge how they feel in this situation. Absolutely. That is, again, for the individual mentioning saying the wrong name around trust. If you are, have an appropriate relationship where you are not, it's not a huge risk that you're going to send the wrong message. It can be really helpful to just validate, this is a perfect example of you keeping yourself safe, leaving a placement where you didn't feel comfortable and you felt, at risk of your safety being violated or your health or what have you.
I think there's one coming through, and I apologize. There's not a way to make it so everyone can see all of the chat boxes. So Sarah and I are trying to kind of quickly read through and summarize all of the fantastic ideas that are coming through. Someone who replied the coverage for gap times when you're not available. And this is so true because our program, we're a 9 to 5, Monday through Friday program for the most part, right? And so providing for that opportunity when it is 3 o'clock on a Saturday morning or 5 a.m., providing for that is helpful directly in that moment for the young person to know who to call at that time. But it also helps, build that network of safe, supportive people, right? So it's not just us, right? When a youth says, you're the only program, you're the only person, you're the only, it makes me really nervous, right? Because what happens when we get sick and have COVID, or our power goes out and our phones don't ring because we've got this really old phone system in the office, right? Like we want to be able to kind of build those supports because our goal is to support you through that kind of crisis and that stabilization so they graduate and don't need us, right? So building towards that independence was a great piece. Thank you so much for that. Let's look at the second one.
Okay. I just want to add real quick, the person after that said give them info as needed. That is the best way to cover for gap time. So one example of what we do is when we are giving youth phones, when they're in situations similar to this, is adding in a note section or a contact of other providers that they can reach out to when we're not there and letting them know, next time you're in crisis so that you don't have to think about it and you don't have to try to figure out where to go or who to call. It's right here in this phone that we're giving you that will be turned on even if we're not answering.
Yeah, great point. Thank you. Let's look at the second one. And we've got, our WRI amazing people are asking if we would like the attendees to see each other's feedback. If there's a way to fix that, that would be amazing. So hard yes, our amazing tech people at WRI. But let's go ahead and let's look at the second case example.
Okay, so youth is working many hours off the books, which is impacting school attendance and performance. When asked, youth says they have to contribute to the household financially. So again, what are some harm reduction frames to work from and follow-up actions to engage with this client?
Okay, so see what resources are around to see if there's state programs to provide spending money. Yep, accessing those basic needs, educating about workers' rights is my favorite. I feel like we talk about labor rights all the time here. Great, so yes, we've got the option to speak to everyone, which is great. Providing gift cards for food or bills.
Absolutely. Yes, that is a big thing we do. And it's also a thing we do where we're still centering that and validating that, a client is working really hard to meet their own goals. And there's probably a lot of pressure on them to do that. If they are going and sacrificing all of these hours where it's impacting their school performance, this clearly means a lot to them. It's not going to be something that they want to hear a Band-Aid, solution for. So even if we're saying here is a gift card to cover your bills for the next couple of weeks so that you can take, some time off and get caught up on schoolwork, there's still going to be some more follow-up after that. So we want to, put a pin in that when we are doing that for a client to make sure we're coming back to long-term solutions. But yes, absolutely, gift cards are a godsend.
And I'll note, so program directors, write this into your budgets, right? Write in phone cards, write in emergency assistance for grocery supports, right? Because this has been one of the most powerful ways we're able to support youth, especially in building that rapport, right? Because if part of their or most of their vulnerability is around not having access to basic needs, if we can come in and provide a winter coat with no strings attached or help with groceries, that might get us in the door to have a second meeting so we can keep talking about safety. We can keep talking about rights and resources and all those things. And if we've got funders on the call, that's why we're asking for emergency assistance money for client supports, right? Because we want to be able to, again, meet those basic needs, address vulnerabilities while we're doing all of the long-term planning, like, food stamps and benefits and cases and all that jazz.
And this is tying in with those independent living skills. So if we're giving a 15-year-old a $50 gift card tops for groceries, we're going to talk through with them. Have you done grocery shopping on your own before? Do you know the average price of things? Do you know how to make this go as far as it can to support your needs as best as it can?
Yeah. And if there is an adult who is supposed to be safe and providing for those food needs, is this a chance where we're, having to go back and make that call for neglect because resources aren't being met intentionally, or has something happened with the family and they don't know how to apply for food stamps or food supports, right? So again, what is that bigger picture while we're working to address those immediate needs, right?
Yeah, and I've seen a few things about school social workers and academic supports. They have absolutely been a huge help in situations like this. They, if it's a case that's appropriate for McKinney-Vento, really, school social workers are my favorite people to work with because they always know all of the resources and they always know what is eligible specifically for their students.
Yeah. Again, looking at family supports, looking for opportunities to earn money, earn assistance without interfering with school. Yep, getting creative. I love it. I'm going to move quickly. I want us to go through one more case example before we switch to doing Q&A. So I'm just looking through to make sure we're not missing anything that came through privately. Again, offering supports to family members. Maybe the safe parents or guardians need help finding that kind of employment resource. Again, especially as we're navigating this, I don't want to say post-COVID, but late COVID kind of space. Absolutely. Looking at alternate school options, GED, after school, afternoon classes. Absolutely. Again, and no limits to the offer. Yes. Yep. We need to be able to address needs in the now. Thank you very much. Right. And again, building those skills and then meaningfully demonstrating that those are, there are no strings attached. Right. Yes. Okay. So let's go ahead and look at one more example. Yep.
Okay. Youth in county/OCFS care have left placement, have no recognized safe family supports, and are unable or unwilling to go into placement in facility or foster care.
Yes. Yep. Providing that information. Right. Where are you willing to go? Where do you want to go? Absolutely. Giving them that choice to be able to say what could be a good fit for them and what might not be a good fit for them. Absolutely.
Yeah, and offering information about shelters in the area and also offering what the eligibility is on certain shelters. So the background information I'm thinking on this is, of course, so they know where to go, where their doors are going to be open to the client, but also maybe they know of other people who are unsafe in the community who might be accessing the same resources that they may be trying to avoid. That it would be an opportunity to talk through safety planning, to loop in shelter staff if that is an appropriate option at that point. So that could be a huge way of building trust with a client as well.
Absolutely. And lots of great ideas around, talking about different step-down placement options. What are their concerns, right? So many of us want to have that emotional response of like, what do you mean I worked so hard to get you into placement? What do you mean you've left placement? Dealing with that piece of things in supervision, taking that deep breath before you pick up that phone call so we can be present and non-judgmental in that call with young person or FaceTime or Snapchat or wherever the kind of platform is. But that, like, what are your concerns? What worked well in that placement and what didn't?
Yeah. What do we want to avoid going forward?
Yes. I love these ideas. We're addressing those immediate needs, but then coming back to long term.
Yes.
Right.
Always.
It's always that both hand.
Oh, huge. Yes. Definitely the clear about your limitations from your agency. Make sure they're not calling you right after this AWOL to say, hey, where do I go next? Or, hey, you did this, so well last time. Why can't you just put me in another placement? So that's where that rights education comes in, of kind of, we don't need to explain to them the ins and outs of our job, but just to the extent that they understand what might happen should they engage in certain risky behaviors or certain actions. It's not inappropriate to say, I've noticed that you have done this before, leaving placements where you don't feel safe. I'm not going to tell you what to do. That's not my job, but I am going to say if you do this, it might not be as quick of a transition into another placement in the future. So always managing expectations.
Yeah. Absolutely. Yep. And we've got another message to the panelists talking about, it's hard when we've got agency policy that says, we can do these things, we can't do those things. But, if the option is something that youth isn't going to choose, then how do we bring in a community partner that has maybe more flexibility in terms of support until we can get to yes, if we're able to get to yes towards returning to placement or wherever that might be. Because again, we've been doing this work for a long time, and we always need each other, right? We have to have those collaborative partners that can, pick up the phone at 4 a.m, or those partners that can, get somebody into that the short version of the GED list, right? We have to work together because each of us has strengths and each of us has challenges that make it harder to be able to get to yes where we want it to be. Absolutely. So again, I love the responses and the focus on talk to youth about their needs and their goals and their supports and all of those things. Awesome. So let's skip our fourth and very fun example. This was real life. This was a real life story, as were the other ones, but let's skip our cases and let's talk to Q&A, because Christine, we promised that we would leave time for Q&A. It's only 8 minutes, but we're here.
8 minutes is better than no minutes. And that's a lot of great information, and I loved all the participation and engagement. And, I am also in one of those positions where sometimes our bureaucratic limitations is probably the best way to say it, really inhibit some of the things we'd like to be able to do to help a young person. But just to reiterate your point, the best thing you can do is talk to that young person, be very honest and transparent about what your limitations are, and see if you can find a middle ground between what we think is the safest option for them and the best option for them and what they want. Because sometimes you can meet in the middle and then reevaluating as you go, right? It's that ongoing safety planning, continuing the conversation. It's not a one and done. So if people have questions, please put them in the chat. If you think of something after the fact, you can either, you can email either Shannon or myself or the human trafficking mailbox, and we can pass along the question or thought to Aaliyah and Sarah. If for some reason we don't get to it today. But I am going to leave a couple minutes. There's a lot of information people may just be processing. And I loved when we talked about the young person who had truancy and performance concerns in school, that somebody suggested maybe an alternative education program, right? Or online GED. As a former educator, I understand that we always want young people in school. But for a variety of reasons, sometimes your typical school day or school program is not necessarily the best fit for that young person for a variety of reasons. If they need to be working to help support their family and they're adhering to labor laws, I want to make sure I give that caveat. An alternative education program, or maybe they're going from like 4 to 7 or a couple hours a day, or it's online, may be the best compromise, right, for both the young person who's doing what they feel obligated to do or they want to do for their family and is still getting a vital component of growing up, which is an education. Okay, I don't see any questions, probably because that's from WRI. That handouts and survey links will be emailed and registered after the conference, as we talked about earlier. If you think of a question after the fact, we can certainly share it with Aaliyah and Sarah. I think there's no questions because you did such a comprehensive overview that you answered all your questions throughout the way. So that's a sign of a job well done. Thank you both so much for being here. I truly appreciate your willingness to train, and anything I ever ask of you, you're more than willing to humor me. So I appreciate that. I appreciate everyone for attending. Thank you so much. And I hope to see you tomorrow morning, bright and early at 10 o'clock.
Thank you all so much. Thanks for having us.
Have a great day, guys.